Hey, my friends, welcome back. So, today I want to share with you a gentleman named Mike Mew. He is an orthodontist in England, and he came onto my radar because of my general interest in the ancestral health perspective on health, right? On how can we look at our evolutionary past to better inform the way that we can go about living today so we can get the most out of our potential, right? Our genetic and physiologic potential. So Mike, as an orthodontist, was very interested in why are so many people in the last three generations needing orthodontic work, whether that's braces to realign the teeth or whether it's extraction of teeth because there's crowding, such as the wisdom teeth, or even some of the other teeth in our mouth get overcrowded and crooked, and if you can't fix it with braces, the standard is to pull them. And Mike started to think, well, wait a minute, this doesn't make very much sense because there's thousands of species of mammals and none of them need any tooth extraction, right? None of them need to get braces. They have a naturally aligned jaw and natural tooth structure. And then he looked back at tens of thousands of years of human skulls, hundreds of thousands of years of human skulls. And what he noticed was that all these folks had plenty of room in their mouth. In fact, he was saying on average, if you look at our evolutionary skulls, even more than 200 years ago, so as recent as 200 years, the vast majority of human skulls behind the wisdom teeth had open space. He said 5 to 10 millimeters of open space behind the wisdom teeth, which in today's day and age, we're told you got to pull the wisdom teeth because there's not even enough room for them to come in. So he was finding that our ancestors actually had extra room beyond their wisdom teeth. And he started to say, well, how could this be? What's changed? And one of the big things people point to is diet, and he definitely talks about diet. But the thing that he was saying that I thought was a really unique element he was bringing to the conversation was he was talking about posture. And he was saying that the change in our overall body posture actually influences the way that the bones of the cranium form. And that as we start to change our posture, we start to change the natural airspace in the airways in our body, right? The nasopharyngeal area and the trachea. And as that starts to change, again, more posture feeds forward onto it. So it's like a feedback loop where as the posture goes, then the form of the body goes, and then the function of the body goes, right? So, and he's tying these three pieces together, that posture leads to form, which leads to function. And what I found really fascinating about this was that he's actually suggesting we have a great bit of control over the way that our facial features are formed. And he was saying that particularly when you're young, which makes sense before the growth plates and the mandible change and the growth plates and all of your facial bones and cranial bones, right? Once they close, then there is limited change that can happen, right? For me, I'm 29 years old, almost 30, so it's a little harder for my bones to change. But he was definitely, and he's shown a bunch of work with his patients who are children that have had tremendous change without needing braces, but actually through postural intervention, he was able to get big change. And I thought this was a really interesting idea. And he was even saying that as an adult, even if the bones aren't going to change shape, through changing the muscle tension relationships, because you have many muscles in your body, and for oftentimes they're antagonists, right? Like your bicep versus your tricep. When your bicep is tight, your tricep has to relax, right? Those are called antagonistic muscles. And so you have all these different muscles all over your face and in your neck that have a great deal of control over the way that your jaw works and of all of the way that everything is held together. So what he's actually suggesting is if we can go back to living in a way that's a little more ancestrally appropriate, and I'll explain what that means in terms of affecting your mouth, is that if we go back to this, we can actually reshape our posture, which then will change the function and the form of our body. So he was saying a couple things that are unique about our ancestors were that they chewed usually very difficult food to chew, whether it was vegetable or animal matter. Both were tougher, and we chomped on it a lot. So our jaws worked harder than they do today. And as a remedy for that, he's saying chew more gum. And by building up the buccinator and the masseter. Those are the two main muscles that control chewing in your body. You're actually going to help reorient the mandible in its location, because the force of that muscle, the tone of that muscle, is going to adapt. And then with the postural aspect, so we're strengthening the body through chewing, and we're also then going to, he was suggesting, close your mouth so that your teeth touch, put your tongue to the roof of your mouth. Now, it's not you're grinding your teeth or clenching hard. You're just closing your mouth and tongue to the roof of the mouth. And that starts to reshape the way that your body is creating a posture, right? So you have these patterns. So if you start to make it a pattern of how you're holding your mouth when you're not talking, just when you're walking around or thinking or sitting at a table or whatever, if you have your teeth together, mouth closed, lips closed, tongue to the roof of the mouth, it's going to start to change the shape of your mandible to the rest of your skull, and that's going to force you to breathe through your nose. And then he said, on top of that, for your global posture, stand tall, shoulders back. And when you do these things, it starts to pull the ears back over the shoulders. It changes the alignment of the cervical spine. And that then changes the amount of space there is for your airways, right? Because we're breathing through the nose. So that's our nasal space. And then we have this pharyngeal space, which is connecting the nasal part into the back of the throat and then down into the trachea. And so if we could start to align this, we could actually create more space for our trachea, which is going to create the ability to breathe more deeply. And we've spent some time talking about different breath strategies you can have that will oxygenate your body more fully, which then gives more oxygen to every cell of your body, which is important for the health of you at the cellular level all the way to the whole organism level. So I thought this was really interesting. I want you to go check out his stuff. Mike Mew, M-E-W. He's an orthodontist in England, and he has a bunch of cool stuff on YouTube that you can start to dig into and understand what he's talking about. But he's actually had a tremendous amount of progress with people who are young, because they can actually change the shape of their skull much more if they're still in a period of life where they're growing, where the bones have not ossified fully. They still have open growth plates. So if you know anybody who's young, definitely check out Mike's stuff and try to help the children that you know through postural intervention, maybe change the need of getting teeth pulled as they get older or having to have braces or whatnot. So check out his work for that. And then if you're beyond the point of skeletal maturity, like myself and probably many of the people watching this, then you can do some of those simple things. Chew gum on a regular basis so that you can strengthen the muscles in your jaw and around your jaw, as well as keeping the mouth closed, lips closed, tongue to the roof of the mouth. That starts to send neurological signals to your body of proper alignment. And work through the nose with the breath as opposed to through the mouth with a slack open jaw. And think about keeping the ears back up over the shoulders with a nice tall posture. And then that's going to allow you to have a better flow of oxygen in and out of your body, which is very important. So, my friends, we're going to leave it at that for today. Go check out Mike Mew's work. I think it's really interesting, and it definitely fits in with how we can live a better lifestyle through having a little bit more knowledge, as well as having just a couple strategies that separate you from the rest, that give you a little bit of a different way to approach living. So remember, function and form are deeply connected. You can change your form through your posture, right? The habits of how you hold your body in space. And that can have tremendous impacts over the course of your life. So continue to adapt and thrive. I love and appreciate you.